Good morning. I'm Denise Brown. I'm a nephrologist at UAB. And for those who don't know what a nephrologist is, and I'm sure it's many of you, it's a kidney specialist. So I take care of people who have chronic kidney disease, that is, who've had kidney disease for a long time, as well as people who are on dialysis and people who had a kidney transplant. And my goal, of course, is to keep people off dialysis, so to slow the progression of kidney disease. I'm sorry I can't be with you today, but thanks to an iPhone and technology, here I am. Well, I thought we would start with a true or false question. We'll do a couple of them, and then we'll get into the meat of the talk. So true or false? 1 in 9 American adults has some form of kidney disease. Let's say that again. 1 in 9 American adults has some form of kidney disease. Is that true or false? Well, it's true. So 1 in 9 Americans has some form of kidney disease. Fortunately, for many people, their kidney disease is mild and they don't need dialysis or a kidney transplant. But the fact that someone has kidney disease makes them at increased risk for heart disease. Also, people who have kidney disease need to be followed carefully to avoid progression to where they need dialysis. In this country, there are more than 500,000 people with what we call end-stage renal disease. Those are people who either need dialysis or a kidney transplant in order to stay alive. As I said, kidney disease is a risk factor for heart disease, and as African Americans, we are 3 times more likely to experience problems with our kidneys than white Americans. Also, in African Americans, kidney disease tends to be diagnosed at a later stage than in Caucasian Americans, at a stage when there's so much damage that things are not reversible. Okay, let's do another one. True or false? Diabetes and high blood pressure, also known as hypertension, are the 2 leading causes of kidney failure in this country. And by kidney failure, I mean people who need dialysis or a kidney transplant in order to survive. So is that true or false? That diabetes and hypertension are the leading causes of kidney failure. That too is true. 44% of people who start dialysis or who get a kidney transplant in a given year do so because of diabetes. And 28% of people who start dialysis or have a transplant, it is because of high blood pressure. So more than 70% of people who end up on dialysis or need a transplant end up there because of either diabetes or hypertension. So, who is at risk for kidney disease? Well, we've talked about diabetes and hypertension. Those are the 2 obvious ones. But other people, black people, Native Americans, both groups have a higher incidence of kidney failure and kidney problems than whites, for example. People who have a family history of kidney disease are at higher risk. So if your mother, father, sister, brother have kidney disease, you're at a higher risk, regardless of what caused their kidney failure. Unfortunately, older people are at higher risk of kidney disease than younger people. So with every birthday, your risk of kidney disease goes up. I say that because I had a birthday just a few weeks ago. And finally, people with heart disease are at higher risk of kidney problems. And it's important to know this because if you're in any of these groups, you really need to be followed and you need to pay attention to your kidneys before they cause you to pay attention to them. So what I'd like to do is talk a little bit about, I'm going to use some fancy words, kidney anatomy, so what the kidneys look like, kidney physiology, what they do, the signs and symptoms of kidney disease, how we diagnose kidney disease, and what treatments are available. And we'll probably have a handout which will show you some of the pictures that that I don't have right now to show you. But if you look at a picture of the kidneys, what you find is that there are 2 kidneys, 1 on each side. They're in your back, sort of almost near your backbone, just below the rib cage. And the kidneys are making urine 24/7. And the urine drains into these little tubes called ureters and carries the urine to the bladder. So even though your kidneys are making urine 24/7, you're not peeing 24/7. And that's because the bladder holds onto urine until you can find a time that's socially acceptable to get rid of it. When you look at the kidneys in cross-section, you find that there's an outer part called the cortex and an inner part called the medulla. And if you look with a microscope, you'll find that each kidney's the size of your fist, each kidney has 1 million filters. And these filters are connected to a tubule, a little tube. So blood goes through the filters, some of it's filtered through into the tubule, and then the little tubules manufacture urine. So they convert blood into urine. There's an artery, an arteriole that supplies the little filter with blood, and another arteriole that takes the blood that's not filtered away from the little filter. So diabetes tends to be a disease that damages the filters. High blood pressure tends to be a disease that damages the blood vessels, so the little arterioles. And of course, you can have both diabetes and high blood pressure affecting your kidneys. So what do the kidneys do? I mean, everyone thinks, oh yes, the kidneys get rid of waste products, and they do. The kidneys are kind of like a washing machine and a dryer. A washing machine because they clean the blood of toxins, and a dryer because if you drink a lot of fluid, it's the kidneys that get rid of excess fluid. So that's what they do, but they do other things too. The kidneys help maintain blood pressure. So if you were to have a hemorrhage, the kidneys would make something called renin that would help bring the blood pressure back up. They control levels of fluids and electrolytes, so sodium, potassium, magnesium, calcium, phosphorus. The kidneys control all of those electrolytes in your blood, and normal kidneys will keep those electrolytes at a really good level and regulate them very tightly. The kidneys also make a protein that helps prevent anemia or low blood, and the kidneys prevent damage to the bones by activating vitamin D. So the vitamin D that you take as a pill or that you get through sunshine is inactive, and the kidneys make it active and therefore useful for the body. Okay, let's do another true or false question. True or false? You can lose 90% of your kidney function and not know it. Let's say that again. You can lose 90% of your kidney function and not know it. Is that true or false? That's actually true. You can lose, when God made the kidneys, God made a whole lot of excess kidney material. So many people do not know that they have kidney disease until they have severe and irreversible kidney damage. So we'll see people come into the hospital sometimes who have a history of nausea and vomiting for a couple of weeks, and when we draw their blood, they're in complete kidney failure. They may be peeing, but they're not getting rid of the waste products. Other symptoms of kidney disease: swelling of the eyes, sometimes swelling of the feet, we call that edema. The urine can be foamy, like soap. They have a froth on it, and that would indicate protein in the urine. Blood in the urine can be another sign of kidney disease. Sometimes you can see the blood with your eyes. Sometimes we have to look at it under the microscope. Some people will notice sudden onset of high blood pressure, and that can indicate a problem with the kidneys. Or if you've had well-controlled high blood pressure and all of a sudden it goes out of whack, that may indicate a kidney problem. And finally, symptoms like nausea, vomiting, fatigue, shortness of breath, itching, those can be signs of kidney failure too. But those signs can also be signs of other things. And by the time you have those symptoms, usually your kidneys are really, really failing, and you've lost maybe 90% of your kidney function. So it's important to be sensitive to the other symptoms I talked about: the swelling, the foamy urine, the blood in the urine. And it's also important to see your doctor regularly if you're at risk for kidney disease. So how do we diagnose kidney disease? Well, the best thing for a nephrologist or specialist like me, the best way to diagnose kidney disease, unfortunately, is through a blood test. You gotta get a needle. But the needle and the blood will tell you what's going on. There's something called creatinine. Creatinine is a waste product that you get rid of in the urine. Everybody makes creatinine 24/7, and we get rid of it in the urine. When the kidneys are damaged, creatinine builds up in the blood. So that was God's gift to nephrologists, so we can follow people's kidney function. The other test that we do is a urinalysis. Pee in the cup. When you pee in the cup, they can test the urine for protein, they can test it for blood, so they can look at a lot of the things. By looking at what the kidneys make, that is urine, we can screen for the we can screen for kidney disease. There are other tests that we can do. We can measure the protein in the urine. We could do other blood tests that will help us determine whether the kidney disease is from something like lupus or something like high blood pressure or from diabetes. And then there are tests like ultrasounds and other things that might need to be done too to further characterize the kidney disease. So once someone is identified with kidney problem, it is important that they get follow-up. And the reason why they need to be followed very carefully is because kidney disease does not get better. How do you treat kidney disease? Aggressive control. Sorry. I hope we can cut that part out. But aggressive control of blood pressure. So it's very important that the blood pressure be controlled. Ideally, we want that top number less than 130. If I rule the world, less than 120. So aggressive control of blood pressure. Good control of blood sugar. If you're a diabetic, you should be following your hemoglobin A1C. That's what I call the report card test. That tells you what your kidney function, your blood sugars have been doing for the past 3 months. So know your hemoglobin A1C. You want to avoid drugs that can affect the kidneys. I'm thinking of things like what we call non-steroidal anti-inflammatory agents. Motrin, Nuprin, Advil, Aleve, goodies, I call them baddies, ibuprofen, all of those things, naproxen, all of those drugs can affect the kidneys. So you need to avoid those. In fact, Tylenol, or acetaminophen is the other name for it, is the only safe over-the-counter pain medicine that you can use. All the others can affect the kidneys. And finally, there are 2 classes of blood pressure medicines. They're called ACE inhibitors and angiotensin receptor blockers. And those have been shown to be protective of the kidneys over and above their blood pressure control effects. So how do you identify them? An ACE inhibitor usually ends up with pril, captopril, enalapril, lisinopril, quinapril. Those drugs are blood pressure medicines that really help the kidneys. The other group are the sartan drugs, losartan, candesartan, etc., etc. And those 2 help the kidneys over and above their blood pressure control. And you should be, if you have kidney problems, as long as you don't have a contraindication or problem with them, you should be either on a sartan drug or a pril drug. So finally, what happens if the kidneys fail? Because even with good blood pressure control, even with blood sugar control that's excellent, sometimes people's kidney problems progress to the point that they need to be treated. And so when the kidneys fail, there's several things we can do, several treatment options. Hemodialysis, which is what most people have heard of. Traditionally, you go to a dialysis unit, they stick a needle, 2 needles in your arm and run your blood through the machine for 3 to 4 hours. You can actually do hemodialysis at home, you can do it when you sleep, so there are a lot of variations of hemodialysis. The second kind of treatment is peritoneal dialysis. Most people aren't familiar with that. You have a tube in your belly, and you put clean dialysate or dialysis fluid in the belly. It sits there for a while, and then it removes the toxins, and you drain off that fluid. Again, you can do that by hand 4 times a day, or you can do it with a machine while you sleep. And then the third kind of treatment that's available is kidney transplantation. And that's where you get a kidney either from someone who has died and signed their organ donor card, or you can get it from a living donor. So those of you who are healthy, think about being considered as a kidney donor. Think about giving a kidney to a loved one or even a stranger, because that could get people off dialysis. And what we found is that people who are transplanted tend to live longer than people who are on dialysis. So let's just summarize what I said, and I hope that people have found this information useful. Diabetes and high blood pressure are the leading causes of kidney failure. So if you have either of those 2, you need to see your doctor regularly. You need to ask, what is my creatinine? What does my urinalysis look like? What is my hemoglobin A1C? Although there's no cure for kidney disease, it can be treated. And by treating kidney disease, we can prolong the kidneys and prolong their action for a long time. Control of blood pressure and blood sugar are really important, and then avoiding medicines that can make the kidney function worse, such as I said, non-steroidals, things like Motrin, Advil, and Aleve. And finally, ACE inhibitors, the pril drugs, and angiotensin receptor blockers, the sartan drugs, are drugs that can be used to slow the progression of kidney disease. I hope that you found this information helpful. There's several websites that you can look at too, where you'll get good information, and I'm happy to provide those for you too. I'll say them here, but we can give them to you as a handout too. The American Association of Kidney Patients, aakp.org, the National Kidney Foundation, kidney.org, and DaVita Dialysis, which is davita.com. All of those sources are places where you can get good information about your kidneys. So take care of your kidneys and enjoy the rest of the conference. Thank you.